Hi everyone, this is examination 1 information. We'll be jumping around on a number of different topics. Alright, here we go. First we'll discuss risky behaviors. These are things that threaten your health. So you want to make sure you're identifying these things in your classrooms or in your populations, whether you're in the prison system, things of that nature. Human immunodeficiency virus, known as HIV. It endangers the health by destroying the immune system, and you're more at risk for opportunistic diseases, and also talking about sexually transmitted infections, the distinction between viral and bacterial. Bacterial are much bigger, and viruses are much smaller and invade a host cell. And basically they're hiding, and if you think of a virus as an ant and a bacteria as a baked potato, you can see the difference in size. So that makes a big difference in terms of studying those different types of microbes in order to find different solutions to help cure different bacteria and viruses. That's why it's much easier to cure and find cures for bacteria, because they're much larger and they don't have to invade a host cell, basically hide, whereas viruses do. The most common sexually transmitted disease in the United States is chlamydia, and it's not gonorrhea or genital warts or herpes. And talking about childhood obesity, jumping around a little bit, it definitely increases a number of health risks. It does not always result in childhood obesity, and it's not beneficial in any way to be overweight. A lot of the changes in the K through 12 system started in the 80s, where administrators and politicians started doing away with physical education, and as a result, the number of cases of people that are overweight and obese increased, and have continued to do so over the last 30 years. So it's definitely a concern. There has been a movement by the government and the states, and a lot of the pro franchises and leagues, the NFL, Major League Baseball, to make a push for different healthy goals for kids in particular. So that's something that's very important, that continues. When we're talking about eating disorders, it's not something that deals with appetite or something that's digestive or metabolic, although there has been some proof over the last couple of decades that it is a hormonal issue. But primarily it's a mental disorder, typically about somebody's control issues and feeling a need to control their food consumption and what they put inside their bodies. When it comes to physical activity, it is likely in most cases to reduce chronic disease, and not necessarily something that's acute or in the short term, or eating disorders or accidental injuries or genetic disorders, but things that are more long term, trying to make sure that over the course of your lifetime that you maintain good cardiovascular health, because that will help you to prevent chronic diseases as you age. So again, most of what we're talking about on a number of different issues with regards to this first exam just is more of an overview of a lot of different things. And the main purpose of the CDC, the Center for Disease Control, one of the government agencies that oversees different things for domestic purposes, and they report to the World Health Organization. And a lot of times the local agencies will report to the state agencies if there's an outbreak, and then they will report to the Center for Disease Control, obviously, and issue any types of warnings that might need to be addressed domestically. And sometimes it comes from the top down, from the World Health Organization, and then that will be disseminated to the various countries in the world, here in the United States, and then if appropriate will be instructed to the states, and then here locally if there's anything that needs to be addressed from a health perspective. So we're trying to promote healthy behavior, and these coordinated school health programs are to try and promote healthy behaviors, facilitate achievement and success. A lot of classrooms have incorporated yoga and meditation as young as kindergarten, all the way through seniors in high school. So it definitely helps with positive self-esteem, and helps with accident avoidance, helps people concentrate more, especially in sports and athletics. So it goes across the board in terms of promoting healthy behaviors for young children, middle school and high school. And during the process of implementing healthy goals and achievement-oriented type learning outcomes, there are intentional injuries that sometimes will happen, unfortunately, but unintentional injuries are not always accidental. They're accidental in nature, and intentional injuries are the leading cause of death for teenagers in some people's perceptions, but that is not true. And so it's important to, again, just be aware of some of the pitfalls that different age groups might have to go through based on their upbringings, and obviously socioeconomic and demographically will impact them as well. Teenagers are at a high risk of sustaining motor vehicle accident injuries because they tend to take risks more than other populations, and alcohol use is definitely a significant risk, even from early ages of middle school, and can lead to unsafe behaviors, and also it's a significant risk for a lot of drowning cases, coincidentally. The weapons that are most likely to injure U.S. teenagers are firearms, and a lot of times it's just simply making sure that the safety precautions are in place to make sure that children in particular don't accidentally fire off a firearm that's not in a secure location and not locked. In terms of violence, teenagers, boys are more likely to commit suicide than girls, and a lot of these behaviors that we see that are regarding violence, it's typically men and boys are the recipient of violent behaviors. A lot of times people think it's girls and women, but it's not, because typically the acts are against men and boys. Although most high school students have attempted to smoke, most are not current smokers. But the one thing that I think is always been true, and a lot of times, as you're growing up, as adolescents in particular, you don't really know chemically how you might respond to experimentation with even gateway drugs, alcohol, or tobacco in particular, that might lead to the use and abuse of more harder drugs like marijuana, or methamphetamines, which has become very, very popular in certain parts of the country, in particular West Virginia, and they are having a hard time keeping up with the number of cases of overdoses, because it's very cheaply made and produced, and is easily accessible. So this is very, very concerning for parents. And my point was that you don't always know what your reaction is going to be chemically. So you might think, well, I'm just sort of a thrill seeker, and I like to experiment. And then what happens chemically is that your body becomes addicted, even with one use, and then it's very, very difficult without intervention to stop this behavior. The psychoactive effects of alcohol, which is one of the most used and abused depressants for adolescents and young adults through high school and into college, but in particular what we're talking about here is middle school and high school. The psychoactive effects of alcohol are due to its properties as a depressant. And those who smoke cigarettes and drink alcohol are more likely than non-smokers and non-drinkers to use illicit drugs, as we mentioned. So, the more that you're engaging in multiple risky behaviors, and you have problems going on in your home life, and then, very quickly it can snowball and go downhill for a lot of these young children. In that same vein, when it comes to risky behaviors, a lot of times in middle school, obviously, and in high school, hormones are really starting to kick in, and again, a lot of times just things are out of control, and early sexual experiences has major effects on the risk of contracting sexually transmitted diseases. And it's important that the same precautions and discussions take place at an early age with regards to this. Otherwise, there can be teenage pregnancies and very problematic viral and bacterial sexually transmitted infections that can take place. Again, with a bacterial STD, there are antibiotics, but with a viral STD, it can have not only long-lasting physical implications with regards to one's chronic health in the long term, but with regards to childbearing down the road. And it's important to understand that most sexually transmitted infections do not have any symptoms, up to 90% in some cases. So when up to 90% have no symptoms in a lot of the cases, and you're engaging in unrisky behaviors, it can be a deadly combination in many instances. So in the United States, teen mothers often have a second child within 2 years of the first, for various reasons. A lot of time it's just not being educated, seeking attention, following in the footsteps of a lot of what they have seen their entire lives growing up. There's a clear and direct link with regards to poor eating habits and the leading causes of death in the United States when it comes to cancer, cardiovascular disease, strokes, and so that starts at an early age, and a lot of times it's the accumulation of these behaviors over the course of time, and it's important to develop these very healthy habits emotionally, physically, mentally, and teach those good habits, starting in the kindergarten, first grade, early age classrooms. Accidents, unintentional injuries, homicides, suicides, cancers, and heart disease make up the 5 leading causes of death for teenagers. Motor vehicle fatalities is the leading cause of accidents among deaths among teenagers, and that's about a third of all deaths to teenagers, unfortunately. Talking about suicide can be a plea for help. Always want to take that seriously. And I know from this experience firsthand, my stepfather committed suicide when I was 9, and there's a lot of things that accompany having to go through something like this, especially as a young child or as an adolescent. And you, again, want to take it seriously and ask if they're putting a plan together. 90% of people have thought about suicide at one point or another in their lives, and again, about 10% have thought about it seriously. The survivors of suicide usually say there were signs, but they might have ignored them, just dismissing them as something that's not serious, and they were joking, things like that. So always take that very seriously. No matter how much useful information and fresh content you have, switching gears about website design, because that's something that a lot of teachers and students, namely, are wanting to develop. If the visitors can't get beyond the home page, you definitely have some work to do. The home page, from the beginning of time, has remained one of the most important pieces of your real estate on any website, and Google is a great example of how things are kept very simple. If you look at the search engines, typically you don't have to scroll down. It's very, very straightforward, very simple, and you don't want to have to cause people to scroll down and sideways, and you want everything basically just to be what the eye sees on that single page. Okay? It's important that your call to action is focused on mainly to prompt a response, and if they're not clear, your visitors won't know what you want them to do. So keep this in mind. Get creative, with your headlines to catch the visitor's attention. You don't want to have a counter at the bottom. You can always ask your administrator the number of hits that you're getting on a website. Talk about your school, what makes it unique. Make sure you take into consideration ADA compliance, so that screen readers and other issues with regards to your content can be accessed at all times. Your website should illustrate everything that makes you different from the neighboring schools. If you're trying to promote your school, how is your mission different? If it's a charter school versus your traditional school in the public or private sector, how is the student experience unique? Get feedback from other faculty and parents. Do testimonials. Those are always very powerful. The best way to know whether your homepage is getting the job done is to do polls. You can use SurveyMonkey. There's a lot of different things out there to help you to get some feedback and put that feedback back into the system to make adjustments. I do that all the time with my class and my syllabus, for example, to make adjustments to make it more user-friendly and get the information disseminated in a timely manner. And so always take that feedback and have open lines of communication with regards to your website. ask colleagues for feedback. Have them look at the website and give you their opinions. So you don't want to give your audience an abundance of information, as I said earlier, on the homepage, because that will overwhelm them. Use your website analytics to find out which pages are the most useful. Once you narrow it down, start directing your visitors to these pages. When something is buried under a half dozen websites or at the bottom of a long wordy page, for example, no one will ever find it. So keep it simple, okay? If you have forms that you want them to fill out or feedback questionnaires, make sure it's quick without much hassle. I've visited thousands and thousands of websites and pages as a coach and as a college professor, as a high school coach and instructor, middle school instructor, and I can't tell you how happy it makes me to be able to navigate something quickly with the proper links and things being accessible, because in the interest of time, it's very important that we make things as easy as possible for the consumer. Okay, switching gears again, going back to unintentional injuries, burns and fire safety facts in 2015, and there's always a delay in the statistics domestically and at the state level and locally. But in 2015, there were 334 children ages 19 and under died from fire or fire burns in 2013. In particular, 87%, 291 deaths were in residential home fires. So 44% of the children who died from fires or burns were age 4 and under. The death rate for children is almost twice that of 5 to 9-year-olds and almost 4 times that of 10 to 14-year-olds. The death rate from fires and burns has decreased by 53% from 1999 to 2013, and the big reason for that is requirements in rentals, carbon monoxide and carbon and fire detectors have been mandated and definitely changed the landscape of these types of deaths over the last 14-15 years. The death rate from fires and burns, as I said, even though it has decreased by that number, 53%, the number of deaths from fires and burns among children 19 and under has increased 30% from 2012 to 2013, so the last couple of years. From 1999 to 2013, the fire burn fatalities and death rates among children in ages 19 and under, 126,035 children under the age of 19 were seen in emergency rooms for fire and burn injuries in 2013. It only takes 2 minutes. It only takes 2 minutes to a fire to fill a home with the black smoke or engulf it in flames. So the most deadly fires occur at night, most of the time it's caused by hot liquids or steam are more common. The hot liquid or steam burns are the ones that are reported more among young children compared to contact burns caused by direct contact with fire, which are more common among older children. Tap water burns most often occur in the bathroom, obviously, and tend to be more severe and cover a larger portion of the body. The maximum water heater temperature of 120 degrees is important. The medical costs for hospital admissions for unintentional fire and burn injuries in children's 19 and under average about $14,498 per case, so it's very expensive. Only 23% of homes in the U.S. have a fire escape plan and practice it. So there's been an increase in the number of smoke detectors, but in terms of having a plan in case of a fire, that has not really been emphasized, and changed over the last 20 or 30 years. When it comes to recreational unintentional injuries, nearly 80% of people who die from drowning are male. Children ages 1 to 4 have the highest drowning rates, and in 2014 among children 1 to 4 who died from unintentional injuries, 1/3 died from drowning, unfortunately. And minorities, with regards to this, between 1999 and 2010, fatalities from unintentional drowning rates for African Americans was significantly higher than that of whites across all ages. Disparity is widest among 5 to 18-year-olds. Disparity is most pronounced in swimming pools, which would make sense. African Americans between the ages of 5 and 19 drown in swimming pool at rates 5.5 times higher than those of whites. Factors such as access to swimming pools, desire or lack to desire how to swim, choosing water-related recreational activities may contribute to the racial differences in drowning rates. So some of the factors that influence drowning will be a lack of swimming ability. Sorry about the barking, but again, the lack of swimming ability. Many adults and children report they can't swim. The lack of barriers, such as pool fencing, prevent young children from gaining access to the pool area. A lack of close supervision, obviously. Location. People of differing ages drown in different locations. For example, most children ages 1 to 4 drown in home swimming pools. The percentage of drownings in natural water settings include lakes, rivers, and oceans increase with age. More than half of fatal and non-fatal drownings among those 15 years and older, roughly 57%, occur in natural water settings, which would make sense. Failure to wear life jackets, alcohol use, obviously increase risky behaviors. Seizure disorders can increase the risk for unintentional injury deaths, with bathtubs as the site for highest drowning risk for people with seizure disorders. So coming back to physical activity, most high school students do engage in some form of physical activity, and the Safe and Drug-Free School programs is a loose coalition of private substance abuse prevention programs, is what most people think, but that is not the case. However, a coordinated school health program is one that addresses comprehensive physical, emotional, and intellectual and social well-being. One of the most important goals of the physical education curriculum is to teach competence in a variety of competitive sports. Again, is what most people think, but that is not the case. It's more of lifelong learning, lifelong activities, and sports is just more of an extracurricular competitive situation, but that it's not necessarily to have as a part of the curriculum teaching competence in competitive sports. When you're reading this book, you'll see that there's a number of different topics that are discussed, from health literacy and health knowledge, helping you with different lesson plans and how to organize your classrooms. And it's important to understand that health literacy is not the same as health knowledge. Among U.S. high school students, between 50 and 75% have reported having at least one drink. Switching gears again, when it comes to risky behaviors, the leading cause of death for Hispanic and African American youths is unfortunately homicide, not domestic violence or motor vehicle accidents or suicide, but again, homicides. Which one of the following do you think is true with regards to teen suicides? Do you think it's that most suicide victims were already receiving mental health care? Most teenagers reported having attempted suicide at least once, or that boys are more likely than girls to attempt suicide, or programs exist to address most of the problems that lead teenagers to kill themselves. And the answer is the last option. Programs exist to address most of the problems that lead teenagers to kill themselves. So identifying this is definitely very important, and again, taking it very seriously. People that smoke, or with regards to smokeless tobacco, they can cause nicotine dependence and obviously increase cancer risk. Not only cancers directly related to tobacco and smoking, the lungs, and oral cancers, but all types of cancers. Smoking among teenagers is strongly correlated with negative childhood experiences, and not at all with people that have high grades or mature early or are participating in athletics. Among children, high school students, again talking about risky behaviors, between 40 and 50% report had sexual intercourse, and so this is something that, again, if it's going to continue to happen at this rate, that education is very important for young adolescents and high school students and middle school students. Some of the advantages of different school sizes, varies, depending on the population, but there are definitely more leadership opportunities in smaller schools, and that the landscape of charter schools has changed definitely over the last 20 years.